Hello everyone, and welcome to Henry Schein series on COVID-19 on YouTube. I'm Dr. Gary Severance with Henry Schein, and it's my pleasure to welcome back Dr. David Reznik, who will be updating us on all things related to the recovery from the pandemic. And maybe for the first time in the 2 years of this program, some really great news. Dr. Reznik, welcome.
Thank you, Dr. Severance, for that positive introduction today. As we know, for the last several months, there hasn't been a whole lot of good news to share, and we are actually in a period of time right now with spring, which is renewal, with spring training starting for baseball, if that's your thing. Flowers in your garden are starting to come up if you're into flowers. There's just so many wonderful things that are happening now, at least in the United States. I'm going to go from the United States perspective. And sometimes you just need a little bit of good news. I was working on this presentation. I actually was doing the research for this presentation, and I was tired. It was a Sunday, and then I get this email notification that my favorite ball player, my favorite football player, the GOAT, was returning to Tampa Bay. Now, you might not be a Brady fan or a Buck fan, but for me, I grew up with this, and knowing that he was coming back and bringing people brought me just a little bit of joy. I think the message I want to share is it's been so much stress and so much bad news and so much difficulty over the last few years. We need to start looking at the positives. And we're dental professionals and we are leaders. We are team leaders. So our goal here is to still provide the safest dental visit, give you some information to share with your staffs, with your patients, with your family, with your churches, with your community. But let's go to something that's good for a change. So here we go. What are our objectives? We'll review the COVID-19 community levels by state and county, and that is so important. Understanding these measures. I mean, we can say something is low or middle or high, but what does it actually mean? So when patients or family or staff ask, we can give our answers to that. Review the White House's new COVID-19 response strategy, including this test and treat program. Be aware of the impact that COVID-19 has had on our most valuable players, our dental hygienists in the United States. And then one thing I am concerned, because we are in a lull, we are in a period of quiet, but please be aware of the possibility of an epidemic of COVID complacency during this period of low community levels of SARS-CoV-2. So even though I'm positive and even though I'm going to give you some good news, starting off with our map. Our map has been red for almost the 2 years since we've been counting this data. And for the first time that I've done a presentation on this 2-year series, and this is our 2-year anniversary of doing these, and thank you for tuning in, the majority of the map is green, which means low community transmission levels. There are some middle community transmission levels and a few high levels, but for the most part, the country is doing really well. But I want you to think about what's happening right now in the UK and in other places where they have dropped they've dropped a lot of their common sense measures. If you're going into a crowded grocery store or something, they weren't wearing masks, things of that sort. And now they're having another bit of an upturn. So I don't want us, with the good news, with seeing this green, I want us to stay green. So when I talk next month, or when I talk at Thrive Live, that will have good news to share and continue with the good news. But you can see the majority of the United States is in a low community transmission level. This is information from my hospital. In the beginning of the year, and actually in the middle of January, we were close to having 300 patients in the hospital due to COVID. Not that people who are coming in for something else and who tested positive, these were COVID patients who are in our hospital. And if you look now, our numbers are actually below 50 and are staying below 50. So that is a remarkable change from an area at the beginning of the year of significantly high transmission, significant high hospitalizations, overuse of our ICUs, et cetera, et cetera. And now we're in this period of quiescence or quiet. And so it gives you actually on the ground, not federal information, but information from the 5th largest public health hospital system in the country. So how does the CDC measure the COVID-19 community levels? And it's a little bit different. It's not just tests anymore. So it's a combination of 3 metrics that are used: new COVID-19 admissions per 100,000 population in the past 7 days, the percent of staffed inpatient beds occupied by COVID-19 patients, the total new COVID-19 cases per 100,000 population in the past 7 days, and new COVID-19 admissions and the percent of staffed inpatient beds occupied represent the current potential for strain on the health system, and data on new cases acts as an early warning indicator. So what is our early warning indicators? Well, you can look at wastewater. And yes, there are some areas in the country where we're seeing a little bit of an increase in wastewater. I'm not going to say COVID is over. It is not. By no means do I think that this pandemic is over, but do I think we're in a good place right now? Yes. Do I want us to stay in this good place right now? Yes. So if you look at this, when you look at your community levels, and that's so easy to look up, just look up COVID data tracker, and you can find out what your community transmission levels are, and you use the highest level that applies to you. So if you look at new COVID-19 cases per 100,000 people in the last 7 days, if it's fewer than 200 per 100,000, then new COVID admissions per 100 is an indicator. Percent of staff inpatient beds occupied by COVID-19 is an indicator. And if it's less than 10%, then we're at low transmission. If it's between, say, new COVID admissions per 100,000, if it's between 10 and 19.9%, we're in a medium level of transmission. And if it's over that, over 20, we're in high transmission. If it's 200 or more per 100,000 people in the last 7 days, there is no low transmission. That means our new cases are high. That's an early warning transmission. So we're all basically either in medium or high. So again, you look at new COVID-19 admissions in the hospital per 100,000 population. Less than 10 is medium, greater than 10 is high. Percent of staffed inpatient beds occupied by COVID-19 patients. Again, low wouldn't work. We're having 200 cases per 100,000 or more. Less than 10 is medium, greater than 10 is high. So I'm trying to give you an idea that it's a combination of these numbers is how we get to this. We want fewer than 200 cases per 100,000 people over the last 7-day average. We want the new admissions to be less than 10 per 100,000 population for a 7-day total. We want our staff inpatient beds to be less than 10%. And why? Just like we have a bit of a hygiene crisis, a dental hygiene crisis, trying to hire new hygienists or maintain hygienists, nursing staff has been just really decimated by this pandemic. They have been over, our frontline workers truly have been miraculous in what they've dealt with over the last 2 years, as are our teams, because we are frontline workers as well. And I'm concerned about all of the different stressors that are out there. We have inflation rising, there's a war in Europe, there are shortages of certain items, gas prices are going up. I want us to look at something positive during this period of time and try to maintain it. So let's decide, what prevention steps do we take for low transmission, which is the majority of the country right now? Stay up to date with your COVID-19 vaccines. Remember, staying up to date means that you have had the booster. And I'm a bit concerned about the booster level in the United States because it's only about 29%. And I'm going to show that we're one of the lowest countries that have actually done boosting in the world. If you have symptoms, get tested. I actually had to have a procedure done, a diagnostic procedure in the hospital. So I had to go into an urgent care center and get a COVID test, a PCR test. It was back before, actually before I woke up the next day. And so you get your results pretty quick. Medium, if you're at high risk for severe illness, talk to your healthcare provider and take appropriate steps. So mask when in groups, wear other precautions as necessary, stay up to date with your vaccines, and again, get tested if you have symptoms. For high transmission, we really need to continue masking indoors. Again, stay up to date with COVID-19 vaccines, get tested if you have symptoms, and additional precautions may be needed for people at risk for severe illness. So again, the goal is to keep it low. If you have symptoms, all three of them get tested. Stay up to date. All three of them want you to stay up to date with your vaccines. We have to do a better job of talking about the importance of getting the booster, and I will talk about that. But here we just have an idea of where these levels come from. Again, just going into the low level, which we are in, it's based. I put this on there because of things that we are doing. During low transmission periods, should we do anything different when it comes to managing our patients? In my opinion, and that's what I'm giving you, I am doing everything that I did in the heart of the pandemic. We are still screening. We are still using rubber dams as appropriate. We are still using tools to help our hygienists. We have extraoral evacuation systems that are in use. We have HEPA filtration in every room. I mean, we really have taken steps to improve our ventilation. And so the reason I brought this slide up is how we protect ourselves as the individual and household prevention behaviors. But I also want to stress, don't let your guard down in your dental offices. If I am doing an exam, and I'm going to be as honest as possible, do I need to put my N95 fit tested respirator on? If I'm just doing an exam, I'm fine with FDA approved KN95. I'm fine with a mask and shield. I'm doing a research study right now, and when people come in, by the time I come in to do my exam, I have on an N95. I am just doing a very brief exam. But for aerosol generating procedures, a fit tested N95 respirator is still what we need to use. But let's go back to our community and information that we want to share. Again, stay up to date with your boosters, maintain improved ventilation throughout indoor spaces when possible. Now, the South gets very hot, as we all know, during the summertime, and we did have a sort of a spike last year in Florida when it got really hot and people went inside, sort of the opposite of winter up north. Follow CDC recommendations for isolation and quarantine, include getting tested if you're exposed to COVID-19 or have symptoms of COVID-19. If you're immunocompromised or high risk for severe disease, have a plan for rapid testing if needed. Remember, there's those government tests that came in. You can go to an urgent center, you can go to a CVS. There are plenty of places, Walgreens, whatever, where you can get tested. And talk to your healthcare provider about whether you're a candidate for treatment like oral antivirals and monoclonal antibodies. So there are certain things that we have been doing that we need to maintain. 2 years later into the pandemic, our recovery is uneven. Some areas have done better than others, and the road ahead does remain unclear. So my positivity is about where we are now. Things are quiescent, things are quiet. Daily caseloads are lower than they've been since July. Mask mandates and other public health requirements have been rolled back. And it's giving us a sense of relief. And I think that we need this after a winter of soaring infections due to the end of the Delta variant and the beginning of the Omicron variant. So these are things that we really have to understand. We see a lot of grinding on our patients, a lot of chipped teeth on our patients. We see some TMJ symptoms from stress that they're under. And I'm sure that as dental healthcare workers, we're under stress because we are right in the face of our patients. But 2 years into this, we should know what to do. We should follow our infection control guidelines to make sure we're providing the safest dental visit possible. However, the virus is still claiming thousands of lives every week, and new variants can emerge. There actually was reports just yesterday of a new variant being identified in Israel. We have to have so there are two scenarios. I'm an optimist. I think that you can tell. I like to look at the optimistic perspective, which is why I'm excited to give today's presentation, is that we get a new variant that's not as transmissible as Omicron, not as lethal as Delta. So there are new variants that are going to form. Remember, this is a global pandemic. And there are several countries that are, like, for instance, Hong Kong is having a problem right now. Britain is having a problem. Even China is putting some places back on lockdown because their numbers are going up. The pessimistic scenario, which is not where I come from, is the next one will be bad or worse and sickens many people. We will need to remember to do the other things that work. Get vaccinated, get boosted, wear your mask in appropriate settings. You just can't take your foot off the gas pedal completely. And that's really what's happening because people are tired of COVID. And I understand that. I truly understand that. It has changed our lives. We're getting back to normal. Let's do some common sense measures. Staying up to date, wearing your mask when appropriate, don't forget hand washing and hand sanitation, and doing all these things so we can stay with an optimistic scenario. I did want to bring up today a little bit about the effectiveness of Pfizer Biointex mRNA vaccine in preventing SARS-CoV-2 amongst children and adolescents and this protect cohort. This is a CDC MMWR that was published earlier this month. What do we know? Receipt of 2 doses of the Pfizer vaccine has been shown to be effective in preventing infection with SARS-CoV Delta variant in people aged greater than 12. What is added? Children and adolescents aged 5 to 15 were tested for SARS-CoV-2 weekly, irrespective of symptoms during July 21 through February of 2022. Approximately a half of the Omicron infections were in unvaccinated children, and adolescents were asymptomatic. 2 doses of Pfizer BioNTech COVID-19 reduced the risk of Omicron infection by 31% amongst children aged 5 to 11. And I'm sure you've heard a little bit about this on the news. That's not a great reduction. And by 59% or closer to 60% in ages 12 to 15, and that would be significant. The implications that they're saying is that all eligible children and adolescents should remain up to date with recommended vaccines. So this is sort of an interesting graph. I sometimes have so many words up on there. I thought I'd put in some pictures today. So did you have COVID-19? If you answer no, you managed to avoid a virus that has infected an estimated 140 million Americans, or 43% of the population. Knock on wood, I'm one of those people. I have not had COVID. The official tally of US COVID cases to date is about 80 million people, but that reflects only confirmed cases reported by states. Some people have been infected more than once. Many others have never been tested, or they had rapid tests and they weren't reported. To arrive at a more accurate number, health authorities look at blood tests that detect antibodies for infection, so that you've been infected. These estimates indicate that more than 140 million Americans, about 42% of the population, have had COVID-19. That's about double the rate reflected in our national case counts. So remember, you can identify that you had COVID. Remember, up to 50% can be asymptomatic or pre-symptomatic. That's why we treat every patient as if they have an airborne pathogen. And it's also important to remember that we're also protecting against influenza. Our flu vaccine regretfully missed the target this year. So all of the precautions we are taking to prevent COVID is keeping us safe from the flu. Did you have long COVID? Now you can tell from this graph that it's a much smaller number, but a very important number. I actually have more than one friend and several acquaintances that do have long COVID, and it's not possible. It's one of the pandemic's most vexing problems. It's something that we're just learning to understand. There is no agreed upon definition or diagnosis for this condition. So we have a group of symptoms that we're calling long COVID. And what do they tend to have? It's a collection of symptoms that can include fatigue. And I mean serious fatigue for people that I know that are advocates and activists who really have a hard time staying awake. Even one of them fell asleep during a webinar, during a conference call. So, I mean, it's really draining. Shortness of breath that continues for a period of time, or brain fog lasting 4 weeks or more after infection. There are between 7.7 million and 23 million people in the United States who have had or have long COVID now. That's up to 7% of all Americans, up to 16% of the 140 million Americans estimated to have gotten coronavirus. Even mild illness can cause long COVID. So this is something we want to avoid at all costs, because I don't want to be in that small section that has long COVID, because we're really looking to see if this is going to turn out to be like a disability. So from mild infections, you can get this. From asymptomatic infections, you can get this. The best way to avoid long COVID is to avoid COVID. It can happen no matter what virus variant occurs. There's evidence that there's no evidence there's any difference between Delta or Beta or now Omicron. We should always be aware that when people get symptomatic infection, anywhere from up to 10 to 30% of people will go on to have persistent symptoms. So that cough that seemed to last for a long time, or shortness of breath that lasts for a long time, or exhaustion. We do know for absolutely certain there is post-COVID syndrome. Anywhere from 25 to 35% or more have lingering symptoms well beyond what one would expect from any post-viral symptom like influenza. It's fatigue, shortness of breath, muscle aches, sleep disturbances, what people refer to as brain fog, according to Dr. Fauci. There's also this growing evidence that COVID-19 is linked to diabetes, something that doctors are still trying to understand. There are a number of factors that need to be showing up in recent studies with long COVID, ranging for things like type 2 diabetes to viral load, as well as things like autoantibodies. So it's still a new pandemic. And it's still things that we're learning about. And that's why I'm glad that you're here, so I can share some of this information, try to whittle it down to things that hopefully are useful for you and your practices. The CDC is no longer recommending universal contact tracing, so that's a good thing as well. Almost 2 years after the director of the CDC called for 100,000 contact tracers to contain the coronavirus, they said this week that it's no longer recommending universal case investigation and contact tracing. There's just far too many people who are getting this disease. It encourages health departments to focus on the practice in high-risk settings. The turning point comes as the national outlook continues to improve rapidly, with new cases, hospitalizations, and death all continuing to fall. Again, my reason for being optimistic, even as the path out of the pandemic remains complicated. It's not over yet. It also reflects the reality that contact tracing programs in about half of the US states have been eliminated. So you can't have a federal program if half the states aren't participating. So the White House did unveil a new COVID-19 response strategy, which has 4 main objectives: protecting against and treating COVID-19. Remember, a while ago, I talked about antivirals that you take for 5 days that help keep you out of the hospital, make sure you stay alive. Preparing for new variants. We go from one to the other. Right now, we're dealing with BA2, which is a subvariant, but I told you earlier, Israel has detected a new variant. Will it be something that turns into a variant of interest or a variant of concern? Far too early. Avoiding shutdowns. As you can see, the people of the United States weren't very happy with the shutdowns, and the government is now supporting that. And then this is a global pandemic, so we need to do what we can, our part and other parts of the world that have resource to help the parts of the world that don't have resource. So if there's a vaccine that we can get to sub-Saharan Africa that doesn't need to be kept in cold temperatures, that can be like a traditional 1-shot or 2-shot vaccine, that's going to be something that's really helpful. The Test and Treat initiative enables Americans to get tested at a pharmacy and to receive antiviral pills on the spot at no cost if they are infected. But the pharmacy has to have a prescriber there. It can't be a pharmacist just giving you this medication, and it's just getting started. So hopefully you found some test and treat places. I actually, when I got my test before that procedure, I really didn't ask about it because this is a brand new process, and it is going to take money to do this. A program to boost research into long COVID was announced by the Secretary of Health and Human Services, and they're going to look at new centers of excellence to provide quality of care for these with this new long-term COVID, because it really is debilitating for a lot of people. And so having centers of excellence to be able to treat and manage the symptoms and get back to normal life is really important. Accelerated research into new vaccines that could be ready with 100 days of the emergence of a new variant. All of these initiatives need funding from Congress, and that still hasn't happened, which includes the 1.5 trillion spending bill that would fund the US government. So actually it was not included in that. It's going to have to come from a different source. Funding for pandemic-related measures is expected to be $15.6 billion. It breaks down to $10.6 billion for Department of Health and Human Services Emergency Fund, $4.5 billion for global health programs, and $500 million for humanitarian services. So US to launch these tests, as I'm talking about, CNN reports that Pfizer's Paxlovid, which I talked about earlier, and another COVID antiviral pill, molnupiravir, were widely hailed as pandemic game changers when the US FDA authorized them in late December, and that's when we actually cover them. Taken within the first 5 days of COVID symptoms, they can reduce the illness severity. So the test and treat program is able to increase access to the medications by creating a one-stop shop. You get your positive test, so within 5 days you get your prescription, and if you take these medications by the prescriber, then you can, within minutes, then you can stay out of the hospital and hopefully avoid long COVID. And you take this medication at home. The issue is it's going to take some time to get this up and running. So if you can talk to your primary care providers about where they can get these medications, if you test positive, be prepared. It's like how we are prepared for an exposure to a blood-borne pathogen. At this point in the other pandemic I covered, HIV, we know what to do. We're prepared. However, now in our offices, we need to be prepared if there is an exposure and what to do. If we're doing COVID testing in the dental setting, which I highly recommend, and you get a positive, you can literally have them get to their physician right away and get on these medications if they so choose. But it is going to take some time to get it up and running. Low COVID-19 infection rates, high vaccination rates, slow return to work is what the hygienist study reported from the ADA and ADHA. And this was from research conducted between September 20 and August 21. And I'm sure most of us are familiar, but hygienists are such an important part of my public health program. Our greatest limitation is time. And we don't want to be redoing things due to re-decay. So our hygienists in my program are the ones that keep our patients healthy. In my dentist, we address disease, we restore function, but hygiene is so very important for all aspects of what we do. Fewer than half of the dental hygienists who left employment early in the pandemic returned to work in 2021. And so that's why, as I said, I've had a little bit of issue hiring my third hygienist. If anybody's interested. The finding is a part of research conducted by the associations between September 20 and August 21st, 21, as I mentioned earlier. There were almost 7,000 dental hygienists across the US, Puerto Rico, and the Virgin Islands. The associations examined the impact of COVID-19 pandemic on employment, on infection prevention, and vaccine acceptance amongst dental hygienists, and the research was published February issue of the Journal of Dental Hygiene. As of September 20th, 2020, 8% or so of study participants who had been employed in March 2020 were no longer working as dental hygienists. That was a tremendous loss for our profession. That percentage, though, did drop to about 5% as of August 21, as some hygienists returned to work gratefully. However, about 1.6% of participants said they no longer intended to work as hygienists, possibly representing a permanent reduction of 3,300 dental hygienists nationwide. That is a significant reduction in our workforce. Despite seeing recovery in their patient volume, dentists continue to report challenges recruiting and retaining dental hygienists because of the pandemic. So I am a dentist. I am seeing increased patient volume. We're having a lot of patients who want to come back to care, but I am having a very difficult time recruiting dental hygienists. Retaining hasn't been an issue. I have staff that have been with me for 30 years at this point. On the other part of good news, dental hygienists had a low rate of COVID-19 infection and a high rate of vaccinations. Let's hear it for our hygienists who are doing the right thing. The cumulative infection rate amongst hygienists was 8.8% as of August 21, compared with almost 12% amongst the general US population. Again, hygienists doing a good job. Also, as of August 21, 75% of hygienists had been fully vaccinated against COVID-19, a higher proportion than the general public and healthcare workers overall outside of dentistry at that time. We knew we had a risk to ourselves and our patients. We did the right thing for the most part. Workplace safety is of paramount importance to dental hygienists, and it affects the employment pattern. So that's why I think I've been able to maintain my staff, is because I may have gone over the top with all of the steps that I took, but I needed to make sure that my dentists, my staff, my patients, and their families stay healthy. And it underscores the need to adhere to infection control guidance and proper PPE. So we're in a good period, a time of quiescence. We still need to do all of the PPE we were doing when things were bad. This study of dental hygienists has shown the profound impact of COVID-19 on clinical practice, as well as the value of disease prevention measures. And there's the lead author of this study and the director of education and research for the American Dental Hygienists Association. Thanks so much for your work. We're pleased to see that dental hygienists have demonstrated continued low incidence of infection due to their strict adherence to PPE and high vaccination, providing the profession's ability to lower the risk while providing care in a safe manner. Increased vaccine availability and greater supplies of PPE should further enable us to maintain our safety and reduce transmission in the dental setting. So if we look at just the general news, this is the NFL. Their COVID protocols will be lifted immediately. Now Major League Baseball has lifted their protocols immediately. And why did this happen? Because infection prevention methods are working. And the prevalence and severity of COVID-19 trends are encouraging. The evolving guidance from the CDC changes to state law and the counsel of our respective experts. So this is what the NFL is doing. It will no longer mandate testing, mask use, COVID-19 signage, isolation, and room capacity limits. Players who test positive will still have to notify their teams and only be required to isolate for the 5 days recommended by the CDC. But the NFL memo stated, should there be a reason to reimpose aspects of the protocols or to take other measures, we will work closely with clubs, the Players Association, and our respective experts and local, state, and federal public health officials to continue to safeguard the health of the NFL. The same will be held for the Major League Baseball and any other people in the sports world or whatever other worlds who are dropping their precautions. I still believe that we still need to take precautions when we're in large indoor group sessions. Or when I go to the grocery store, I'm going to wear my mask. If I'm outside, I'm not going to wear a mask. If I'm going to dinner, unless the restaurant requires it on entry, I'm not going to wear a mask. And I am going to be in Vegas on April 6th, and hopefully you'll see me without a mask. But then again, according to the Players Association, if there are reason to reimpose aspects or protocols or take other measures, they'll work with clubs, etc. We need to follow the community transmission rates in our own areas. But we also need to make sure we maintain the CDC guidelines and make sure we have our fit tested annually, annual certification of your fit tested N95 respirator, making sure that you have your airflow correct, all the things that we've been talking about over the past 2 years. And this is something that does concern me. And I'm going to read this because this is someone's opinion, and I sort of mirror this opinion. Isn't it great? The pandemic is over. We don't need to wear masks. The virus is contained. Forget about getting jabbed. They don't work. The vulnerable are protected. The variants are benign. The issue is, and I'm reading it as if I said it, none of this is actually true. The pandemic is not over. We still need to mask in certain areas. By no means is this virus contained. Vaccines actually do work, and we can show that by hospital data showing that by far the vast majority of hospitalizations and the vast majority of deaths were people who were not vaccinated whatsoever, and I will show you a chart on that shortly. So any proclamation that the pandemic is over ignores the potential of a new variant showing up with high transmission and immune escape. We will still benefit from using masks for many situations, including protecting our immunocompromised loved ones and vulnerable people, which also includes nearly 100 million Americans who have not been vaccinated, many without infection-acquired immunity. We are still averaging about 50,000 confirmed cases a day and about 1,500 deaths at a time when rapid tests are increasingly being used and not factored in. So there's more than threefold level of new cases and twofold the number of COVID hospitalizations than in June of 21. So we're not over this yet. We're just in a really good period of time. The vaccines, particularly with a booster, work exceptionally well to protect against hospitalizations and deaths. And we have to do a better job, not with our staff. We've done a great job with our staff. A great job with dental hygienists, great job with dentists and dental assistants and our front desk staff of having them up to date with their vaccines, but that's not necessarily the case in the general public. The new CDC data indicates that a 3-shot 92% reduction of hospitalizations and a 96% reduction in deaths during the Omicron wave through the end of January 22 across all ages 18 and plus. For only 2 shots, for people who didn't get the booster, the reduction of hospitalizations was 75% and deaths 85%. So you still are getting some protection from those 2 shots, but we should really ask our patients when we're doing our medical history updates, are you up to date with your vaccines? Have you had your booster? Just say up to date. Don't be demeaning, et cetera, et cetera. We can sell a crown. We can sell health. That's what we're in the business to sell, is healthcare for all. If you look at the age-adjusted rates of COVID-19 associated hospitalizations by vaccination status in adults greater than 18, looking at October 2021 through January 2022, if you look at our orange line, those are unvaccinated. So you can see a higher rate per 100,000 of the population being hospitalized. And that number is starting to go down a little bit, but it's still very high. If you look at the blue, it's fully vaccinated without a booster. So you still see we've got good protection, but the rate per 100,000 is grown in January due to Omicron. It's still a little bit higher than it would be, but it's still much more manageable than those that are unvaccinated. And the lighter blue line is actually the rate of hospitalizations for fully vaccinated with an additional or booster dose, and that number is remarkably low. So we have evidence that boosters work, we have evidence that vaccines work, we also have evidence that people who are unvaccinated are much more likely to end up in the hospital. So when we talk about the epidemic of COVID complacency, the United States ranks 55th in the world for booster shots and 67th for the 2-shot vaccinated. Now, I know we have a very large and a very diverse population in the United States, but this is unacceptable. It's remarkable that we are at the lowest rate of primary vaccination and booster uptake since the beginning of the respective campaigns. So what does this actually look like? This is the busiest slide I've actually ever showed in a presentation, and I've been doing this for a long time. But if you look at the left part of the screen, Chile is actually doing the best, followed by Iceland, Singapore, Italy, Denmark, etc. If you look on the right and you look at the bottom, okay, total doses per 100,000 residents, we're at 165. If you look at percent vaccinated, 75.6. If you look fully vaccinated, 64.3. And booster doses per 100 residents, 28.7. So we actually are not doing very well when you look at boosting. That Chile has 76.2% boosted. South Korea has 61.3% boosted. The UK, 57% boosted. Netherlands, 51% boosted. Puerto Rico, a part of the United States, significantly higher level of people boosted. China, 39.6%, an enormously large country, boosted. United States, 28.7%. We can and we must do better to maintain this period of quiet. Also, one of the things that, we have BA2, it is a breakoff or a subvariant of Omicron, and it is causing a majority of cases in different parts of the world, and it's starting to increase in the United States. It does not cause a more severe illness, but it is 30% more contagious than the original version of Omicron, the BA1. But normally a new variant is going to come up from its own self. It's not going to be a variation of an existing variant. And so this sort of gives you the tree of the alpha variant, then we had the beta variant, gamma variant. You can see that different things broke off from them. Sigma variant is a little bit new. Of course, the Delta variant. So the Sigma variant is our theoretical variant. If we had another new variant, it would come out on its own. It wouldn't be a subvariant like we have with Omicron. So it's the wrong time for us to become complacent, and I know we're tired. We've really changed our life, our work environments have changed, our programs, our offices, our businesses have suffered, but our vaccination and booster rates have left us in a highly vulnerable position, worse than many low and middle income countries. As I said, we must do better. Premature cessation of mitigation measures, particularly in many regions of the country with high levels of circulating virus. Now, right now, that's a small number, leaves our immunocompromised population susceptible. Immunocompromised people are in our families. They are in our churches. They are in our practices. They are in our neighborhoods. The math for a more harmful version of the virus isn't so favorable. Not taking advantage of this moment to get ahead of the virus instead of being entranced with a false sense of security will just add to a big historic miss. And I do agree with that. I think now, as we're living life again to the fullest, if we can go to spring training games down in Florida, we can watch what your team is doing in the draft. It is time for March Madness and things that we all enjoy. We can do them, but please still stay safe. As our flowers are beginning to bloom and there's freshness in the air, let's get a new positive attitude about this, take advantage of lessons learned, and see if we can get a hold on this pandemic. As always, it is an honor and privilege to be able to talk to you. As a lifelong Buccaneer fan, I'm enjoying this. As a basketball college fan, I'm enjoying life at this period of time. And I hope you'll come and enjoy some time with me and many other wonderful speakers at Thrive Live 2020, which will be April 6th through 9th, in Las Vegas at the Bellagio Hotel. I'll be there presenting on how not to gamble, how to keep your patients and team healthy during uncertain times. So Gary, it's always a pleasure, and I'll see you soon. Bye-bye.
Thank you, Dr. Reznik, for the continual updates over the past 2 years, and thank you for watching. Please email us any questions, concerns, or requests for future topics at webinars@henryschein.com. And please subscribe to our YouTube page by clicking the subscribe button below. And to be notified of any premieres, click the bell icon. Thank you once again for your attention over the past 2 years. And until next time, please stay safe and stay informed.